teaching on the readmission rates of pediatric patients with asthma by Ryan Crow, Justine Eversole, Kayla Jones, and Shelby Tomer, the University of Cincinnati College of Nursing. So background and significance. We found that there's an increased need for pediatric discharge teaching about risk factors, causes of asthma exacerbation, and common triggers. Our studies found that up to 40% of pediatric asthma patients will be readmitted at one point in their childhood. Our research shows that ER visits for asthma exacerbations have increased among pediatric patients and result in readmission shortly after being discharged. We found that there's a lack of education amongst healthcare professionals about asthma, which facilitates a lack of understanding amongst the family and patient population upon discharge. So this graph compares preventable readmissions in pediatric asthma versus pediatric diabetes. It compares sex, age range, and location of residence. As you can see, pediatric asthma has more readmissions in each of the three categories that they researched. So this just shows that there's a growing need for education and discharge teaching to help better lower these readmission rates. Our PICO question is, in nurses preparing to discharge pediatric asthmatic patients, does providing additional education about common asthma triggers and readmission factors increase the nurse's knowledge about these triggers and factors?
The participants for our project were registered nurses who are responsible for discharging pediatric asthmatic patients at Cincinnati Children's Hospital Liberty campus. Both male and female nurses participated, with female nurses being the majority. For our educational tool, we utilized a poster board with information relevant to pediatric asthma education, sourced from the research articles gathered for our project. In conjunction with the poster, a verbal presentation was used to help educate the nurses on common asthma triggers, readmission factors, and steps to take to treat an acute asthma attack. An asthma education pretest was administered prior to the presentation to assess the nurse's knowledge of asthma before the education was conducted. After the intervention, a post-test was conducted to test the effectiveness of our education and see if it increased the nurse's knowledge of asthma.
A 3-question survey was utilized to collect data. Nurses were asked to circle the 5 most common asthma triggers that were in the presentation, fill in the blank with the 3 most common reasons for readmission among asthmatic patients, and to list the steps that a parent should take if their child has an acute asthma attack. Both a pre-test and a post-test were administered. The data was collected and analyzed by grading each test and averaging the percentages of the results. We found the median score for the pre-test was 66%, and the median score for the post-test was 100%. When summarizing our results, our presentation was effective in teaching registered nurses more information about asthma so that they can help reinforce patient and family teaching alongside the respiratory therapists. The data collected prior to the presentation showed that on average, the registered nurses knew about 66% of the information helpful for asthma discharge teaching. After the presentation, the registered nurses were able to show knowledge of common asthma triggers, common reasons for readmission among pediatric asthma patients, and how to treat an acute asthma exacerbation at home. The post-presentation data increased to 100%, showing effective teaching. In conclusion, as nurses, it is important to be able to identify ways that would help the family properly care for an asthmatic child. Nurses that exhibit an increased understanding and knowledge application during patient discharge would have a better chance to prevent unnecessary asthma exacerbations than a nurse who has a knowledge deficit. A continuance of nurse and patient education prior to discharge helps to alleviate the preventable stressors that place the child's health at a greater risk.